Basically, earlier we used to study the individual bones of the skull, but right now it is advised to study the skull as a whole. So basically, the skull has 22 bones in total. Okay. Regarding the basic introduction part, it has a upper dome-shaped cranial vault. This is known as the cranial vault. Okay. It is attached with this base. This is the base of the skull. Okay. So together this cranial vault and this base together they form the cranial skeleton. So this is the cranial skeleton, this part. This part is your cranial skeleton. And this anterior part just behind this orbit from here is your facial skeleton. Okay. So this is the facial skeleton, and here this one together is the cranial skeleton. This cranial skeleton again divided into cranial vault and this base of the skull. Okay. Now, except mandible, all the bones of skull are joined together by sutures and they are immobile and they form the cranium. Now, what are the different bones of the skull? So basically the skull is made up of 22 bones in total except the ear ossicles. So what are the ear ossicles? Malleus, incus and stapes. So where are they present? Not in the ear. It is present in the middle ear. Okay. So malleus, incus and stapes are present in the middle ear. So excluding them, all the bones of the skull together are 22 in number. Some of them are paired and some of them are unpaired. So in the cranial skeleton part, that is this part, we have the paired bones, parietal and temporal, and unpaired bones are frontal, occipital, sphenoid and ethmoid. So this is your frontal bone. This part is your frontal bone. This large front part having this bone is your frontal bone. Temporal bone is present on the temple side. These are your parietal bones which are paired, and on the posterior side is your occipital bone. So this is your occipital bone. This part is your occipital bone. These two bones are your parietal bones. Here is your temporal bone. Here another temporal bone. These are paired, and one frontal bone in the front. This is your frontal bone. Now in the facial skeleton, there are 14 bones, out of which 6 are paired and 2 unpaired. So the paired bones are your maxilla, zygomatic, nasal, lacrimal, palatine, inferior nasal concha, and the unpaired bones are your mandible and vomer. Out of this, usually we used to study during our times all the bones, but right now these bones are not that much important from your perspective. So only the mandible will be covered in your schedule. Okay, and this skull will be covered in multiple classes, not in single class. So in 7-8 classes the whole skull will be covered, because in your osteology only in head and neck part you have to study the skull and the cervical vertebra only. The cervical vertebra is covered, so the skull will be taken gradually in multiple classes. And another bone is important, that is hyoid bone, that is not taught in your standard. So the mandible will be covered. This is the mandible. This is your mandible. This whole bone is your mandible. Here is your maxilla. This part is your maxilla. Not required that much. Okay. Now coming to the parts, as I have already mentioned, it has an upper dome-shaped part, that is your cranial vault. Okay. What do you mean by vault? Any arch or dome-shaped structure that is covering the lower structure, okay, that is vault. So it is a dome-shaped structure, so that is why it is known as vault, cranial vault. Why cranial? Because it is covering the brain or the cranium. So that is why it is known as cranial vault. And it is attached to the base of the skull. This is the base of the skull, and together they form the cranial skeleton. So the whole skull, this whole skull is divided into your cranial skeleton and your facial skeleton. This is the facial skeleton, the bones of the face, and this is your cranial skeleton. And this cranial skeleton again subdivided into your cranial vault and base of the skull. Okay, so So the cranial vault is also known as calvaria or brain box, and the lower anterior part is called the facial skeleton. So it is present in the lower part and it is present on the anterior part. It includes the mandible also. See, the upper part is your neurocranium or the cranial skeleton, and the lower part is your visceral facial skeleton or viscerocranium. Now, before going to the joints of the skull, what are the major functions of the skull? One is brain protection, another is allowing passage of air and food. Function of skull or not? Allowing passage of air and food is any function of the skull or not? It is the function of skull, because remember that this mouth is also a part of the skull only. Okay, this mouth is part of the skull. This whole part is your skull. Okay, so these are the two important functions. Other than that, allowing passage of important nerves and vessels into the brain is also another function. So this foramen, there are certain major holes here. All these holes will be taught to you. Okay, so there are foramen lacerum, foramen ovale, foramen spinosum, such like that. Multiple foramens are there, and through each of these foramen, multiple structure passes. So here is your foramen magnum. Okay, so through this multiple structure passes. These structures will be taught to you. Now the skulls are, the whole skull is, the multiple bones are attached with one another through sutures. These are your sutures. So this is one parietal bone, this is another parietal bone. Together they are attached through one suture. Okay, that is your sagittal suture. Here also in front, this is the frontal bone attached with both the parietal bone through another suture, basically the coronal suture. In the frontal bone there is another suture present, that is also known as metopic suture. Here on the posterior part, in the posterior part, this occipital bone is also surrounded by these sutures. Suture that is known as your, this portion is known as your lambda, and these are your lambdoid suture. So these are your lambdoid suture. This is your sagittal suture. These are your coronal suture, and in front there is another suture in some of the bones, that is your metopic suture. So sutures are the joining points of these bones, and these are covered by certain ligaments known as sutural ligaments. So there is one exception, that is your mandible. So the mandible is attached to the base of the skull through a synovial joint. This joint is synovial. All the other joints are squamous type of joint. Okay, but here the mandible is joined through a synovial joint. This is not a suture. This is one exception. Rest others, all these bones are joined together by sutures. This joint is known as sutures. Okay. So this synovial joint is known as temporomandibular joint. So here is the temple part, the temporal bone of the skull, and this is the mandible. So this mandible is joined with this temporal part through this temporomandibular joint. Temporomandibular joint. It is a synovial joint. And as you know that synovial joints are freely movable joints, that is why we can move our mouth. So basically this picture is showing you the different parts of the skull, the parietal bones, the frontal bone, occipital bone, lambdoid sutures, all I have already mentioned, sagittal suture, coronal suture, that's all. Just recapitulating again that this is your frontal part of the frontal bone having this coronal suture as mentioned here. Then these are your two parietal bones having this sagittal suture. Here is the occipital bone having this lambdoid suture, and this part is known as your lambda. This part is known as lambda. Lambda, how we write lambda? You know na how we write lambda. So that is why this shape is like a lambda. That is why it is known as lambdoid suture. See, that is why it is known as lambdoid suture. Or lambda, sorry, not lambdoid suture. Lambdoid suture is this part. This part is lambdoid suture. This junction is lambda, because we write lambda like this. Okay, that is why it is known as lambdoid suture, lambda. And this portion is known as your bregma. Just for knowing purpose, this is known as bregma. This part is known as bregma. In between your frontal suture, coronal suture and sagittal suture, this junction is known as bregma. Now coming to the anatomical position, so the skull has to be held like this, such that the lower portion of the orbit, this is the orbit or the eye socket, so the lower portion of the orbit should lie in accordance with the upper portion of the external auditory meatus. External auditory meatus, see here. So this is the orbit, this is the orbit, this is the lower part of the orbit, or also known as infraorbital region. That is the lower part of your eye. Okay, here if you palpate in this area, you will see the bony prominence, that is the infraorbital part of the eye socket. So through this infraorbital part up to the upper part of your ear ossicles, not ear ossicles, external auditory canal, up to the upper part, this green line. This should be the anatomical position of the heart, skull. The orbit should be facing forward, and the line, the green line, has to be maintained. This is known as Frankfurt's line. Frankfurt's line. Okay. And if the same line passes through the middle part of the external auditory canal, external auditory canal, you know, external auditory canal is your ear canal. This is your external auditory canal. This is the ear canal. If the line passes, the position is like that, that the line passes through the lower part of your eye socket or the infraorbital part and passes through the upper part of your ear canal. Okay, then this is your Frankfurt's line. And another imaginary line is your Reid's line or Reid's baseline, that passes through again the lower part of your eye socket or orbit and through the middle part of your ear canal, ear cavity. This red line is known as Reid's line. Basically, the skull has to be held like this in simple terms. Okay, like this. The eye socket should be facing forwards, not like this, not like this, not like this. Okay. Now coming to the exterior part. So basically the exterior part of the skull, it has norma verticalis, norma frontalis, norma lateralis, norma occipitalis and norma basalis. So basically the superior part, that is this part, is your norma verticalis. The frontal part, let us see through these pictures. So this is your norma verticalis. You are viewing the skull from your superior view. Here you will be studying the bregma part, the lambda part, this lambdoid suture. This will be taken in individual classes. Okay. So all these sutures will be taught again, and this is the norma verticalis. Then this is your norma, posterior. Okay, norma posterior or occipitalis. Posterior part, norma posterior or norma occipitalis. Here you will be seeing this occipital bone and these two parietal bones and the lambda part and your nuchal lens. Then this is your norma frontalis. In the frontalis part, you will be studying many structures. That is the face part, then all these maxilla and zygomatic bones and frontal bones mainly, and this eye socket or the orbit part. All of this will be taken in individual classes. This is your normal lateralis part. That is, you are viewing the skull from your lateral part. This is your terion, where many bones join together. This terion is very much important because below this terion, one important structure passes. That is your middle cerebral artery. Okay, it passes below this terion part. This is the norma basalis that I was talking about, where you will be seeing multiple foramens. Here you will be seeing foramen ovale. Where is foramen ovale? It is here. Here is your foramen ovale, foramen rotundum. Where is rotundum? Foramen spinosum. Here is your foramen lacerum. Okay, so these things you will be studying in individual classes. So this is your norma basalis. So this 5 structure, this norma verticalis, you are viewing the skull from above or the upper part. Norma occipitalis, you are viewing the skull from backwards. Then norma frontalis, you are viewing it from frontal part. Norma lateralis, this is the norma lateralis part. And norma basalis, that is the basal part. All like this. And another class will be taken for your mandible part. This mandible is separate, it will be taken separately. So that's all, and that's all for your here you will see the supraclavicular nerve. It has been shown now, the supraclavicular nerves. Okay, then you see it in the dissection. So above this deep layer, the investing layer of the deep cervical fascia, here will be your supraclavicular nerve. And there are 2 nerves. One is your C3, C4 cervical plexus nerve, and another nerve is your spinal accessory nerve. Okay, that was your spinal yes, this is your C3, C4 cervical plexus nerve, and the next nerve is your spinal accessory nerve. So other than the boundaries of the posterior triangle of the neck, at least these 3-4 structures you need to memorize. That is why I am showing this again. Whenever you go to the dissection, try to see it by yourself. Okay, that's all.